February is Heart Month, and we decided to ask Dr. Erica this month about just that. And we want to know, checking our blood pressure at home, is this something we should consider doing?
Absolutely. Yeah. So I think, this fits in really well. We've been talking about COVID almost every month, but to tie it in a little bit, we certainly have been home a lot. And it is so nice as a provider to, if we have virtual visits with patients, be able to have them pull out their blood pressure monitor and check it accurately at home. 10 to 20 years ago, we didn't have good home blood pressure monitors, but now they're really available and can be quality. So the bottom line, though, is making sure that you're doing it correctly and accurately, or else it's not going to be very helpful either.
And walk us through some of those steps on what should we do to make sure we're getting an accurate reading.
Right. So, office blood pressures, I think everybody knows they're historically inaccurate, but that's what we used to only go off of. And then people would be put on blood pressure medication inappropriately because your blood pressure is higher at home than, or higher in the clinic than it may be at home. You just battled traffic, you were just brought back, we just weighed you on the scale, and then we slap a blood pressure cuff on you and see what your blood pressure is. So it's better if you're at home and you can get, best is the upper arm cuff. But if it doesn't fit, because there are some people that the upper arm cuff just doesn't fit right, you want to make sure that it's not too tight or too loose. Wrist cuffs are a second, but you would want to bring them into your doctor's office to make sure that they can compare them with their machines and make sure it's accurate. The bottom line is really wanting to sit and rest for at least 2 to 5 minutes before you have it checked. You want to relax, you want to take deep breaths, you want your back to be supported, your feet on the ground, no crossed legs. You want your arm supported as well. You don't want to hold your arm up in the air while you're checking it. You want it supported at heart level. And then it's okay to check it 3 times. In fact, it's actually recommended. The first time, you can trash it. Let 2 to 5 minutes go by, check it again, write it down, check it again, write it down. And you can record all of those, but averaging the second 2 in that relaxed environment is actually pretty accurate. So that's what I love it when people can print out a home blood pressure log and bring it in to their appointment with them along with their device. We can make sure it's accurate. It really helps me know, do they really have high blood pressure? Or if they're on blood pressure medications, do we need to adjust them? Is their blood pressure that I'm getting in the clinic really reflective? So I'm a big advocate of rechecking my patient's blood pressure once they've been sitting in the clinic for a while, but it's hard with the hurried nature of clinic visits these days. And, people at home I just recommend everyone to have a blood pressure cuff, especially if you're sick. I had a patient yesterday who, it was so great. Not great that she was sick, but great that while I was on a virtual visit with her, I could say, check your blood pressure. Tell me what that is. What's your heart rate? She had a sat monitor, which I've also recommended, especially this year with COVID, everybody to have so we can check your oxygen sat. So it's really helpful for people to know what's going on at home. There is a graphic that maybe was already shown, but you can see where those measures can negatively affect your blood pressure. I mean, if your cuff is over the clothing, that's another good important. You really should have it on the skin. It's hard in the clinic sometimes to take your sweatshirt off or your sweater, but at home or in the clinic wearing something that we can get it right on the skin to check it, that can throw it off by 5 to 50 points. So just making sure, don't cross your legs, be rested, keep your arms supported, support your back, support your feet, don't be talking, try to just relax beforehand. And that's going to give us the most accurate blood pressure to keep your heart healthy from a blood pressure standpoint.
Great. Dr. Erica, thank you so much for all that useful information. I know when I go into the doctor's office, I'm like, all right, play it cool, calm down.
Right, me too. Me too. I think I can have high blood pressure and not just anxiety.
Right. Yeah.
Definitely.
Yeah.
Plays
All right.
in.
Great advice. Thank you so much for your time this morning. You have a good rest of your day, and we'll be back after this.